What do you do as a therapist when you're working with someone with a wrist injury? Doesn't matter what it is, but maybe they injured it, they have a fracture, they had surgery, anything like that. Wrist injury, think umbrella wrist injury. What do you do when your rehab feels very stalled, very stuck? They're not progressing and they're getting more and more impatient with you. Like, what the hell? Why am I not getting better? Right? So let's talk about that. My name is Wong. I'm an occupational therapist and certified hand therapist. Over 10 years ago, I started my therapy clinic, and patients want results and they want results fast, right? Can't always give it, but we can try as hard as we can. And over 5 years ago, I started Hand Therapy Secrets to help share what I know, what I do, and to help other therapists feel like they have more choices in their career. So, from a choice perspective, clinical skills all day, every day, you develop your clinical skills. You're going to be able to treat better. You're going to be able to provide better treatments for your patients. And when you do that, you can do whatever you want to do, wherever you want to do it, right? So let's talk about that. So it's something that I talk about with my therapist all the time. We always discuss cases, and they always come back to me frustrated, like, why can't I get more range of motion? How come their pain is constant and I can't get them better? My students inside the mentorship program have the same questions. So let's go over the three things that you could do, you can look at, right? And then you can evaluate and see what can you do about it. So if you're working with a stiff wrist, right? If you're working with a stiff wrist, if it is a range of motion problem at the wrist, understand that we need to get end range of motion, right? You want to get rid of pain, you have to get to end range of motion. So when I talk about end range of motion, so you want to think about, because the wrist relies on supination, pronation, right? So you have to think about supination, wrist extension, as well as flexion, not just pronation, wrist flexion, extension as well. So look at your range of motion. Do you have a joint issue, meaning that when you push on it, it feels really, really stiff, like you can't get more motion? Do you have a range of motion problem? Because there's some things that we can do from a range of motion standpoint, right? Number two, do you lack wrist motion because something is going on in the hand? Is your hand, your fingers, your thumb not moving well? These are the things that I want to encourage you to think about. So oftentimes we're so rushed to go and do something. Huang, show me how to do this. Huang, show me how to do that. The problem is I can show you a million different things, but you have to understand though, like those things, those techniques, those treatments work when you understand why and for what they work for. So not everything works the same. Like you can't use a strengthening technique when you don't even have motion yet, right? You don't need to worry about your hands, right? Your hand part, if all that is good, correct? So, really understanding where the problem is, why you have the problem that you have, will help determine what type of treatment you take. So, if you're looking at the wrist, make sure you're looking at range of motion at the wrist, right? If you're thinking about why is my wrist progress stalled, don't just look at the wrist. Look now at the hand, right? Because the hand sits on top of the wrist and it connects to the wrist. So we think about, right? Here are your metacarpals. You have 5 metacarpals, and the proximal end of your metacarpal connects to your carpal bones. So this part doesn't have a ton of motion, but it still has some motion, right? Outside of the joint itself, in between here, you have intrinsics, right? So, what's going on with your intrinsics that can be affecting how your wrist, right, is moving? So, that is something to really think about and consider when you are stalled. So, you have to learn how to look through every little aspect so you can confidently feel like, I know it's not the hand, I know it's at the wrist level. And third, did you look at the elbow and the shoulder? We got to stop thinking that we are inside this box. and thinking that if I have a wrist problem, that I should only be at the wrist. The muscles that go to the wrist start at the elbow. The muscles that pass the wrist and go to move the fingers start at the elbow, right? And so there's a lot of structures, muscles, joints, and all that good stuff that actually start at the elbow. And when you cannot get better or more results for the wrist, you have to, one, evaluate what's going on in the wrist, and then two, evaluate above and below. So if you're looking below, you want to look at the intrinsic muscles of the hand, and then you want to look at the muscles that go to the fingers, your extrinsic hand muscles, because all of those muscles pass through the wrist. And if those muscles are not moving very well, muscles only get long and only get short. If they're not moving well, they pass through the wrist. And so they affect how the wrist moves. So double check that shit out, right? Now, I love looking above the elbow. Why? Because remember how I said the supination and pronation affects how your wrist moves? Well, you have a distal, right, like a distal joint, right, DRUJ, and a proximal ulnar, radial ulnar joint, right? This is the hinge of your forearm that allows your palm to turn up and turn down. And that's where all the muscles of your forearm kind of roll around. So if you don't have really good supination and pronation, then sometimes your wrist movements can stall. You're not getting rid of the pain, you're not getting more motion. And so you have to toggle between at the wrist problem, above the wrist problem, below the wrist problem. Once you kind of work those things out, like below the hand, like below the wrist problem, right? The hand, that is resolved, that looks good, then maybe you stick at the wrist and at the elbow level. And one of the things that I love doing, and I teach inside the mentorship all the time, you gotta look at that shoulder. When you cannot supinate and pronate, when your patients cannot supinate and cannot pronate, they will start to compensate with their shoulder. Every single one of your patients are doing that. Every last one of them. Every last one of them. And if you dial down into the elbow a little bit more, you're going to find out that a lot of your patients have issues at the elbow and shoulder that are preventing their wrist from getting better. I worked with a patient. She was with us for a really long time. Now, she was a workers' comp patient that injured her wrist, right? She had a distal radius fracture, and she came into us, her fingers were already stiff. She had already developed a stiff hand. By the time she came into us, it was already like that. So here we are, we're fighting the below problem. We're fighting the problem, and then we're fighting an above the problem. Why? Because she has a prior history of a rotator cuff kind of injury that became a frozen shoulder. So she was actually she was getting treatment for her shoulder, and they were going to do a surgery or something like that for her shoulder. And then before she can get that, she fell. And she fell and she broke her wrist, right? And so when we started working with her, we couldn't touch the shoulder because in terms of workers' comp, it was a different isolated case, even though it's the same arm. Everything is connected. But that really limited our ability to get great motion at her wrist. And she ended up going to have a second surgery on her wrist to release and all this stuff. And because we really couldn't touch the shoulder, we were very limited in how well we could get her wrist moving. And it was also, I mean, besides the fact that her fingers were totally stiff, but where do you think those muscles start at? In the elbow. And the elbow is connected to the shoulder. So all I'm saying is, did you check your elbow? Did you check your shoulder? Are you working on those things? Because they're really, really important. I'm helping my students really think outside of the box. I mean, we know in the textbooks, right? I have the rehab of the hand right here, and it tells you, things are connected, but it doesn't necessarily go into how you can fix it and how you can really treat everything, because everything becomes segmented as you're studying and segmented as you're studying. But in the real world, when you're working with patients, you have to put all those components together because it's just all connected. How more can I say when it comes to that, right? So when you're working with anyone who's stalled, ask yourself those three questions and then make sure you're diving into and looking at them. There's a lot of different ways to do the same thing. Of course, I have my, method and technique of doing treatments from a manual perspective to an exercise perspective. You can use kinesio tape. You can use any modality. You can use instrument assisted. I love me some paper tape when it's necessary. Some people love ultrasound. I'm not a big fan of ultrasound, but of course you can use it. There is electrical stim, and then there's things that are really out of the box if you're working in certain types of private practices where they might have red light therapy. We have radio shockwave, which is regenerative therapy. There's so many different ways in which to treat somebody, but it's up to you to figure out where the problem is so you can pick the best solution, meaning treatment. And then you pick the treatment, the exercises that you're prescribing to your patients. There's stretches and then there's strengthening. They're two different problems. How you pick them, how you watch them do them, whether they're doing them correctly or not, or whether, are they doing it frequently enough? Because most people are not doing things frequently enough. And then therefore they're not getting the best results. Sometimes they're not doing them correctly. It's really hard when you have a hand injury to use only one hand to fix it. You're going in at your patients with two hands, right? But it always starts with like thinking like, do I have a range of motion problem, right? So from a range of motion problem, we can sit here and do a prayer stretch all day long. But if you're doing a prayer stretch and you're doing it incorrectly, you think that shit's gonna work? No. So one of the things that I love doing is clasp hand and then palms together, and then you can push like this, right? Because if your elbow is on the table, you ain't got nowhere to go. You can use a table, you can use a wall. There's a million ways to do the same thing. It's just, how are you going to get results for your patients? Are you describing it in a way? Are you teaching them in a way that makes it easy for them, right? If it's a range of motion problem, how are you teaching them to stretch, right? If it's the hand problem, how are you teaching them to lengthen fully their tendons? So for example, same exercise, clasp hand, I'm going to bring my wrist all the way back. Now, if I ask them to open, won't I ask them to stretch those long extensors? I mean, not extensors, flexors, but when I ask them to lengthen those flexors, and then that way when they curl down, then they will curl down better, right? They'll do a hook fist better. All those extensor tendons are going to glide better. And if they can hook fist, that means their intrinsics are looser. Those are some ideas and concepts that I teach inside. So it's just thinking through the stuff. You can do whatever it is you want. You just have to be able to think through, am I picking the right exercises? Some of y'all people are not picking the right exercises. You're picking things that you have seen before because someone else did them. You're going on to YouTube, you're going and watching Instagram stories, things like that, where you're seeing only snippets. You're only seeing snippets. That's a problem. Understand why you're picking the exercise that you're picking. I try to share that, but obviously short form content, we're just like throwing shit out there. But it's up to you. It's just to pique your interest. And then it's up to you to fully understand why you're picking and doing what you're doing, right? So I always show hook when I work with my patients, and I always tell them why it's so important. It's so important because these tendons, right? These tendons, I don't tell them it's the superficialis and the profundus, but it's the extrinsics, right? Those tendons pass through your wrist and affect your wrist motion. So if we don't get those tendons moving really well, then what happens is it makes it harder for your wrist to move. That's how I explain it. Your intrinsics, well, the muscles that are in between your bones, right? They start, where do they start? Down here in your wrist. And they go in between. They come into your fingers. They end into your fingers, into your middle knuckle. And a lot of times when you injure your wrist, when you're trying to squeeze, you tend to, right? Patients tend to squeeze their fingers together before they curl down. And because they're constantly trying to move and trying to move their wrist, they inherently make their intrinsics, these muscles inside their hand, they tend to make them a little too tight. And they tend to go like this, right? Who do we know? They always go like this, and they curl their wrist in. Well, the natural attitude of your hand when you're making a fist is actually to go into a little bit of wrist extension. So inherently what happens is these muscles get tight along these other muscles. So if we can stretch them out and teach them how to be long and be short, then your hand can move better, but most importantly, your wrist can move better. So do you see where I'm going with this? Right? You have to understand why you're doing what you're doing. Your patients have questions, and you, as a therapist, you have questions because don't you want to understand? Don't you want to rule in and rule out what works and what doesn't work so that you can know, hey, this is not going to work. Let me pick another exercise. Because there's nothing worse than working with somebody and not getting progress. You feel the lack of progress. And you have to know when it's okay for it to be slow. Some wrist injuries are very slow to recover, like a stiff hand, right? We just got a new stiff hand. I have a tendon laceration at the wrist. Patient came in, fingers frozen, wrist frozen, very painful. And it's like, if we're not working on the right things, first, second, and third, we're going to end up with a stiff hand that is not getting better, right? So you have to understand how that works and what works. You have to understand when to start looking at the elbow and shoulder. So if I have a wrist patient coming in, their wrist is stiff, their fingers are stiff, I'm looking at supination and pronation. You think I'm looking at the elbow? I'm not looking at at the shoulder. You think I'm looking at the shoulder? I'm not really looking at the shoulder on the first visit. I'm not. I might look at the shoulder a few weeks into it, a month into it, because my priority has to be the fingers and the wrist. They're coming in for the wrist, but my priority are the fingers, because if the fingers are not broken, right? The fingers are not cut, the fingers are not torn. I need to move those fingers. You know what I told my patient? Your wrist has, let's say, two joints, right? Up and down, supination, pronation. Your fingers, 1, 2, 3, 4. You know how Vietnamese people count? Một, hai, ba, bốn, năm, sáu, right? They count the segments, but think about all the joints of your fingers. If those are not moving, then we're going to be stuck. If you're not able to move your fingers, what are you going to use your wrist for? Right? What are you going to use your wrist for? Priorities, people. So usually within a month or 2 months, as I get progress where my priority is, now I'm going to start to look at the shoulder and be like, let's make sure supination, pronation, let's make sure that those things don't get stuck, because if they get stuck, then my wrist and my fingers and everything like that is going to start to stall. So just understanding priority is going to be really helpful. Anyway, I hope this video helps. If you are feeling stuck with your, wrist patients and stuff, try those things out. Come into the mentorship program. We're going to be diving into wrist injuries in the month of August. Every month inside the mentorship program, we have a rotating topic that we lecture on. And then during the calls, we do 2 live calls a month. You don't have to attend if you can't make it all the time, but you can watch it and you could interact with it, and you can send questions and just be a part of the program, be an engaging part, of the program. So every month we have a rotating topic that we talk about. And then during those calls, we open up and we start talking about different cases. You might have a case on a hand, a shoulder, an elbow, or even a wrist, and we'll discuss it, help you think through your case, and just have that kind of like feedback, bouncing back and forth, like what you can think about and what you can do to help progress your patients. So that's essentially the mentorship program. We meet on the first and the third Thursday of the month at 7 p.m. Eastern Standard Time. I'm going to include the link so you can grab more details if you want. Their CEUs, their support between calls, their support on the call, but it is meant to continually develop your clinical skills so that you can work with any case that comes your way. All right. Let me know if this video has been helpful. If you like this kind of video, click the like button, subscribe to the channel, and by all means, feel free to leave me a comment. All right, until the next video, I'll see you soon.